This is a sun-induced dermatosis, as we can see, that we're going to treat with a CO2 laser. This is a sun-induced dermatosis in a reformed smoker. Heavy smoking is a contraindication to CO2 laser treatment, but this is not an issue as the patient stopped years previously, therefore this is not an issue. As you can see, a contact anesthetic was applied using Anasterm. The cream was applied in 2 applications in a thick mask that is being absorbed progressively. The first application was performed 1 hour before the intervention with 3 full tubes in order to cover the face, and the second application was performed half an hour before the intervention, again with 3 full tubes on the whole face. The patient previously took Codolipran, 1 tablet before the intervention, in order to decrease the pain. However, no anesthetic injection was performed, either contact anesthetic or truncal anesthetic. There is no need to inject anything. Everything can be done by contact anesthetic. Now we can start. The apparatus is parametered. The parameters can be seen here. We will start with the lips. We can see here that there is a perioral grid where the skin is slightly thicker, where we can use higher parameters. When we move away from the perioral contour, we will progressively reduce our parameters. I have the parameters that I want. As you can see, they appear on the screen. Let's start. The first impact will allow us to test the pain and enable the patient to know what to expect before continuing. This is what we will be doing all over. The upper lip is the most painful part of the face to treat. As I move towards the center, the pain will increase. We will advance at a certain rhythm, and if you want to, we can reduce the rhythm, and we can also have pauses. Do not open your mouth, as this will protect your teeth. If an impact hits the tooth, this will damage it permanently. Okay, let's start. I'm now moving along the upper lip.
Ça va?
We have treated the upper and lower lip, and we will continue. I'm now increasing the size of the impacts. This was a square impact of small size to give precision around the contours of the lips, and now we are widening the area. As you can see, the anesthetic is only through contact, and it is sufficient to allow the intervention.
Voilà, maintenant on continue. On fait le tour progressivement. Voilà, on va souffler un petit peu.
We continue progressively, and here there is a limit, the bony ridge, which we must not go beyond.
Alors c'est un appareil à pièce à main collimatée, ce qui fait que la mise au point
The apparatus has a collimated handpiece, which means that the adjustments must be done permanently, whatever the distance separating the handpiece and the cutaneous target.
voilà. Et maintenant on arrive sur une peau moins
Now the skin is slightly thinner, we will therefore slightly decrease the intensity of the energy. It was at 300 millijoules,
à 225.
and we will go down to 225. We will continue to go over the entire face in this way.
Perpendiculaire à la cible cutanée.
When we are perpendicular to the cutaneous target, we are at a full power. If we incline the beam slightly, like this, for more fragile areas, we decrease the intensity of the impact, perpendicular to the target.
Perpendiculaire à la cible. Alors, laisse souffler un peu.
I'll let you rest for a while, especially in median parts. It's often more painful here than on lateral parts. We will cover the whole cutaneous surface of the face in small successive squares.
Toujours pareil, on déborde pas.
And again, we must not go beyond the bony ridge.
Donc là on est à moitié traitement. On a
The forehead. Here we are halfway through the treatment. We have performed the first passage of treatment of the epidermis. Now we will perform the second passage, which will lead to dermal retraction. The first passage had a vertical action of de-epidermalization, and the second passage will have a horizontal action of cutaneous retraction. In this way, the skin will stretch horizontally, and this is interesting for the perioral gridding. At the second passage, in the perioral area, the same intensity is applied as in the first passage, but we are more careful compared to what is usually done. Usually, the carbonized epidermal layer is removed using a cotton soaked in physiological lotion, and here we're going to leave it to act as a bandage in order to not go too deep and to therefore decrease the intensity of the burn, which will therefore considerably reduce the risk of burn side effects. As you can see, we're going over this carbonized epidermal layer that we have kept and will soften the intensity of the second passage. Here we go. We keep the filter on as we're going to work on it again afterwards to hollow out the ridge further, but we will do this later on.
maintenant on va sur les
Now we're on the lower lip and chin. These are the most painful areas.
ces endroits les plus douloureux ici. Et maintenant,
We've nearly finished, and we are going to rapidly sweep over the entire face again in order to get rid of the gridding effect of the first passage and to create a harmonious effect.
donc je augmente la taille de mes
But we will decrease the power, therefore I'm increasing the size of the impacts back up to 6 millimeter squares, and I'm decreasing the power.
et à partir
I'm
de maintenant, on va faire un balayage.
now going to sweep over smooth areas such as the rounded edge of the chin. This is a superficial sweep. The nose.
Voilà. Donc,
We're going to spray with thermal water. The intervention is now finished. We have sprayed with thermal water, mineral water, which will stay in contact and on top of the skin. We will then apply an occlusive cream that is both antiseptic and oil-based in order to avoid incrustation. What we want to avoid is infection and incrustation. These are two major risk factors that will prevent healing. That means that it's not only important to successfully perform the intervention, which seems to be the case here, but we must also make sure that the healing process is successful. The second stage is as important as the first. This is fundamental. We will then ask the patient to wash her face under the shower morning and night using a foaming antiseptic soap, and once it is rinsed, to apply an oil-based flucidic acid cream to avoid infection. In the daytime, every 2 hours, she must spray her face with thermal water and then apply Vaseline in order to avoid the incrustation. The skin must be permanently shiny for a week. A scab must not develop. The patient is seen systematically after 2 days. Of course, she is given the phone number of the doctor in case of a problem. Otherwise, she is seen again on the second day, and then every 2 days we will see a red skin that appears healthy. As a precaution, we will give you the phone number of the operator. We will do this straight away. We'll go over what needs to be done morning and night. The patient is given all these explanations in writing. Wash morning and night with a foaming antiseptic soap. Rinse under the shower, followed by application of flucidic acid cream during the day, every 2 hours. Vaporization of thermal water and application of Vaseline. This care must be performed for at least 5 days on average. Once the risk of scabbing has disappeared, then we will apply an epidermal healing cream such as Cicaphate, which will take over the healing process. Do not be surprised if for a day or two you have intense redness with a burning sensation, swelling, edema and weeping. The weeping will last for 1 day, up to a day and a half, and will then dry out.